So what role does prostate artery embolization have in the treatment of prostate cancer? Well, there are three main reasons that generally come up in the setting of prostate cancer. The first reason is by far the most common, and that is if patients have symptoms of an enlarged prostate and are scheduled to undergo some sort of localized therapy for their prostate cancer, I may be referred to perform a prostate artery embolization on the front end before patients will have high intensity focused ultrasound or cryoablation for their prostate cancer. And the main reason is that after you undergo some sort of therapy for prostate cancer, and we can also include radiation in this as well, your symptoms of an enlarged prostate may get worse. Now, this may be from radiation prostatitis or prostatitis from the high intensity focused ultrasound. But if you have moderate symptoms of an enlarged prostate, waking up at night, going frequently, urgently, weak stream, those symptoms may get a little worse after you get whatever localized therapy you're going to get. And if we do prostate artery embolization on the front end, we will shrink down the gland, reduce the symptoms that you're having at a baseline, and mitigate worsening of symptoms down the road as you're recovering from your therapy. So that's one reason. The second reason that you may be referred to me to talk about prostate artery embolization in the setting of cancer is if you are someone with an enlarged prostate, let's say particularly enlarged, even if your symptoms aren't that significant, you would be a better candidate for, let's say, high intensity focused ultrasound if we shrank your prostate down on the front end of things. So a lot of the studies that are done for these focal therapies to treat prostate cancer have size limitations at the prostate. So if you want to stay kind of in the within the size limits of the published studies that we have, you may end up needing size reduction of your prostate gland up front. Typically, prostate artery embolization will reduce the prostate gland anywhere from 10% to 50%. And while people say that's a wide range, generally speaking, the bigger your gland is, the better of a reduction you're going to have after prostate artery embolization. So if you're someone who has, let's say, a 70-gram prostate and you want to get it down to 50 grams so that you'll be within size criteria of some of the HIFU studies or high-intensity focused ultrasound studies, you would undergo a prostate artery embolization on the front end and then undergo HIFU anywhere from 6 weeks to 12 weeks following your prostate artery embolization. So that's the second reason that you may want to consider prostate artery embolization in the setting of prostate cancer. The third reason, which is actually the original reason that prostate artery embolization was first done, is for bleeding in the setting of prostate cancer. So if you're having bleeding during urination, also known as hematuria, prostate artery embolization can slow down the blood flow in the vessels of and around the prostate and allow your body to naturally be able to clot off whatever areas that are bleeding. So those are the three reasons that you may undergo prostate artery embolization in the setting of prostate cancer. One is to reduce symptoms of an enlarged prostate on the front end. Two is to reduce the size of the prostate gland to make you a better candidate for whatever non-surgical therapy you have chosen to use. And then three is if you're bleeding and you need a little help stopping bleeding in the setting of cancer.